There's been a lot of discussion about the Democrats' decision to load up their partisan spending bill with liberal items that are completely unrelated to the pandemic. We're at a key turning point in this crisis. The nation has just endured an historically painful year. The virus has stolen 500,000 American lives. It's thrown millions of children out of classrooms and workers out of jobs. But on every front, there seems to be signs we're actually turning the tide. New cases, hospitalizations, and deaths have been declining. The CDC reports that 1 in 5 adult Americans have already received at least one vaccine dose. That's 50+ million people. 1 in 10 have gotten both shots. And the supply of vaccines is continuing to ramp up, and yet another authorized just last weekend. Meanwhile, science keeps confirming it's quite safe to get kids and teachers back in the classroom with simple precautions that we can accomplish right now. And all indications suggest our economy is poised for a roaring comeback for workers and for families. This crossroads should give Washington a golden opportunity. We could get together on a bipartisan basis like we did 5 times last year, 5 times, and pass more targeted policies to help finish the fight and get the American people their jobs, their schools, their lives, and their country back. A number of Senate Republicans went to the White House just days after President Biden was sworn in, proposing we continue the streak of overwhelming bipartisanship that has defined the COVID-19 response all this time. Our Democratic colleagues said no. They wanted to go it alone, and when you look at their partisan bill, you can certainly see why. Less than 9% of their massive proposal would go to the core healthcare fight against COVID-19. And listen to this, less than 1% goes to vaccinations. You see, they had to leave room for all the completely unrelated left-wing pet priorities, like sending $350 billion to bail out long mismanaged state and local governments, multiple times the expert estimates of COVID needs. Things like massive expansion in Obamacare subsidies that would disproportionately benefit wealthier people. Things like handcrafted tweaks to Medicare so it pays more money to just 3 states, Rhode Island, New Jersey, and the President's home state of Delaware. You might call it a special kickback for the Excella corridor. They had to make room to bankroll things like underground rail in Silicon Valley, upgrading a bridge from New York to Canada, and giving Planned Parenthood access to taxpayer money meant to rescue mom-and-pop Main Street businesses. Sadly, the parts that actually do relate to the pandemic aren't much better. At the same time, the Democrats refuse to follow the science on in-person schooling. They want to pass a massive new set of deluxe benefits for federal government employees, including 15 weeks of paid vacation for folks whose children have the option, just the option, of virtual or even hybrid learning. They want to keep schools closed and then pay a special bonus only to parents who are federal employees because their schools are closed. Now, this isn't a recipe to safely reopen America. To the degree that it even addresses the pandemic, it's more like a plan to keep us shut down. Mostly, it's just what Democrats promised almost a year ago, taking advantage of the crisis to check off unrelated liberal policies.